Welcome. You're here because you want insights fast, so let's get straight to it. Today we're doing a deep dive into something pretty critical in healthcare.
Mhm.
It's about preventing and managing infections for patients who are on long-term ECMO.
Yeah, ECMO, extracorporeal membrane oxygenation. Vital stuff.
Exactly. We've got some specific clinical practice info here, and our mission really is to pull out the absolute must-know points for you on infection control in this complex setting.
And it is complex. ECMO is life-saving, but the longer a patient needs it, well, that risk of infection definitely climbs.
Right. Why is that? Exactly.
It's sort of inherent to the process. You have these indwelling devices, tubes and cannulas. They create pathways for bacteria. Plus, these patients are often incredibly sick to begin with. Their immune systems might be compromised.
That makes sense. So the material we looked at jumps right into stressing strict infection control measures.
Absolutely crucial, non-negotiable, really.
And it lists the things you'd expect, maybe, but emphasizes them. Consistent hand hygiene.
For everyone involved. Every single time.
Sterile techniques for any procedure.
No shortcuts.
And really trying to minimize invasive lines.
Yeah.
Things like catheters, central lines.
Breathing tubes, too, potentially. Anything that bypasses the body's natural defenses.
It sounds straightforward, maybe, but you can see how in a busy high-pressure ICU or ECMO unit, consistency is key.
It's huge. And some studies actually show, just focusing intensely on hand hygiene alone can make a measurable dent in infection rates for these specific patients.
Wow. Okay, so that really underlines the prevention aspect.
Yeah,
It's not just about reacting. And that leads to the next point. Regular surveillance for infections.
Yeah, you have to be looking for it, constantly monitoring, watching for any subtle signs that an infection might be starting.
Because catching it early is critical.
Exactly. That allows for, as the source says, prompt administration of appropriate antibiotics.
Prompt and appropriate. So
Yeah.
getting the right drug quickly.
Yes. Time matters hugely, and so does hitting the likely bacteria effectively based on surveillance cultures or clinical signs. It can be life-saving.
Okay. Now, if someone listening wants to, dig deeper into the protocols, the source mentions the ELSO Red Book. It says it provides comprehensive recommendations. What is that exactly?
So ELSO is the Extracorporeal Life Support Organization. It's an international body. The Red Book basically gathers expertise from leading ECMO centers all over the world.
Okay.
It provides these detailed, evidence-based guidelines on, well, pretty much everything ECMO-related, but there's a huge focus on infection prevention and management strategies.
This was the go-to resource for best practices.
Very much, yeah. It's highly respected.
All right, so we've got the increased risk, the vital control steps, hygiene, sterile technique, minimizing lines, then the surveillance and prompt treatment. And this ELSO Red Book as a key resource.
Right.
But there was one more really practical piece of advice in there. Try this today kind of suggestion.
Oh, yeah, the audit idea.
Exactly. Auditing how well the unit is actually sticking to the infection control practices.
And that's such a valuable step. It's not about pointing fingers.
No, not at all.
It's about looking honestly at your own processes. Where are the gaps? Where can we do better? Maybe, hand sanitizer runs out too quickly in some areas, or maybe sterile barrier use could be more consistent during line placements.
Little things that can make a big difference. It's about continuous improvement, right,
Yeah.
for patient safety.
Precisely. Fostering that culture.
Okay, so let's just quickly recap the main takeaways for everyone. First, long-term ECMO means a significantly higher infection risk.
No getting around that.
It's inherent. Second, preventing and managing this takes a multi-pronged approach. Strict hygiene, sterile procedures, minimizing lines, constant watching, and quick, appropriate antibiotics.
A whole bundle of care.
Third, there are established guidelines, like the ELSO Red Book, that provide detailed recommendations.
Really important resources.
And finally, that practical step. Regularly check how well your team is actually doing with these practices. Find those areas to improve.
Yeah, that self-assessment piece is key.
So that leaves us with a final thought for you, the listener, to maybe ponder.
Considering just how critical and complex ECMO care is, what other really specialized high-stakes areas in medicine might benefit from applying similarly tough, standardized infection control protocols and maybe that kind of regular self-auditing?
It really makes you think about how vital these meticulous practices are, doesn't it? Not just in ECMO, but potentially across many areas of advanced healthcare. Something to consider.